Today, we're very fortunate to have Ira Prigat, the founder and president of Network in Motion, which is an agency, Ira will explain, that focuses on helping medtech companies finding a path to business in Japan. Ira himself, he's a graduate of Tokyo University, speaks fluent Japanese, and I had the pleasure working with him at Itamar Medical as the president of our Japan business. So I've experienced his actual results of generating revenues in Japan firsthand. I think what Ira will share with you today is very interesting. Blueprint, step-by-step blueprint of how to get revenues in Japan early on before regulatory approval. And the importance of it is really the opportunity for startups to have early stage revenue, early stage clinical implementation, KOL development, a lot of benefits before any regulatory approval is available. And that could be career changing or future changing for the company. Quick administration reminder: if you have questions about the webinar, feel free to use the chat function to write your questions instead of verbally, because that way Hannah or Mia can look for it and ask Ira in the right time without interrupting his flow. Ira, all yours.
Thank you, Gilad. Thank you, everyone, for joining. It's a great pleasure to be here again and to share the experience about Japan. Gilad actually gave a very good introduction, so I'll run it quickly. As mentioned, I have experience of 25 years in doing business worldwide in the medical industry, and equivalent time in doing business in Japan. I was part of 2 exits, one as a CEO of Syncron Dental Lasers to a Chinese player, and one under Gilad's leadership as president of Japan in Itamar Medical, sold to Zoll, and Zoll is a daughter company of Asahi Kasei, so for us everything comes back to Japan. I'm doing a lot of activities related to Japan, but let's skip that. You can all invite you to visit my LinkedIn. As Network in Motion, we are actually a business consulting firm that was founded in 2015. Our challenge and our drive is to help Israeli companies enter the Japanese market and to help mature companies managing their Japanese operation. This is also a challenge. I think that our most important activities assisting Japanese companies to find technologies in Israel, and of course we are helping them in the deal flow management and scouting activities. Let's understand a little bit what does it mean Japan, or why Japan is the second largest medical market in the world. So just to give you a perspective, Japan for the last 3 decades is positioned as the 3rd largest economy in the world, but we are not economists, most of us. So I chose to give you, to illustrate Japan's power by comparing the Japanese geographic regions. Japan is divided to a few regions, to the economic power of entire countries. So if you look at the reddish part here, this is Kanto Prefecture. It's the capital. The capital of Kanto is Tokyo, and Kanto is equivalent to the entire Italian economy in its economic power. You can see Kansai in the blue part, which is around Osaka. Kansai is stronger than the economy of the entire Switzerland. But that's one element of the buying power of Japan. You can also compare Japan as a single market by its population. So if you would like to compare 125 million people in Japan, are more or less 6 or 7 equals to 6 or 7 European countries. So this is actually something that can definitely show the Japanese or the Japanese market power. Of course, it's not a fair game to compare Japan to a few mid-sized European countries. So let's compare them to Europe as a whole, and of course to US and China. So as for, I think we all understand that people are working in Europe. Europe today is very scattered. The MDR actually pushed companies to work country by country. So this is an effort that costs money, and each market has its different characteristics. United States, of course, is the biggest market and probably the most lucrative market in the world, but it's also complex. It has different payers, different insurance companies, different structures, there are differences between the different countries within the United States. So at the end of the day, you need a lot of resources and understanding to do business in the United States. And China, well, it's an amazing market. It's very big, very complex, and very risky. So if you have an innovative technology, I wouldn't recommend entering China in your early and mid stages, only when you are very strong and mature. So let's understand, or actually, I would like to take you through some of the characteristics of the Japanese market, so you will understand why, at the end of the day, the implementation of new technologies has a very interesting route. As you can see on the left side of the screen, Japan's birth rate is dramatically decreasing along the years, and it's becoming a national challenge. The Japanese government just this year announced the increasing of birth rate as a national challenge. This means that a lot of effort, economic effort and regulatory effort are directed in this direction. But why I'm telling you that? Because when there is a negative birth rate, the elderly group is decreasing. The ratio of the elderly in the population is increasing dramatically. Nowadays, 30% of the population in Japan are above 65. And when we are talking about such an old, and by the way, Japanese have the longest life expectancy in the world. So when you combine that, the ratio of a population that has high risk for chronic disease is tremendous. We are talking about around 30 million people that are above 65 and are really becoming a burden on the economy. On the other hand, if you are in the women health business or in the femtech business, or your technology could be addressing women health related business, you are really you hit a gold mine, because not only the government is pushing solutions in the women health segment. This market is evaluated this year at $5 billion revenue with 7% expectations of a year-over-year growth. So this is probably a positive side to a very strong challenge. Now, another thing that is also very important is that in Japan, there is a single insurer. The MHLW, the Ministry of Labor, Healthcare and Labor, is the only insurer in Japan, which means that all the burden sits on the government. But that's not the only thing. The coverage, the reimbursement coverage in Japan is between 70 to 90% of the total expenditure. So you understand that when you combine such an old population with such a large coverage by the government, this really creates a very big challenge and a need to reverse or decrease the expenditure. So the Japanese are always, I would say, innovative in a sense, but they are innovative in a way to help their own country solve their bottleneck and challenges. So what is happening is that the government allowed created actually a channel. This channel is called Doctor's Private Import System or Doctor Private Import Channel. And the idea is that because of the medical expenditure and the fact that the Japanese industry by itself cannot provide all the demand, and the Japanese are basing their PMDA approval on collecting local data. They need what they call the Japanese DNA. The government created a channel that foreign, by the way, also Japanese companies, but foreign manufacturers can enter Japan prior to having a PMDA approval. How do they do that? They need to get the approval of a specific doctor. Doesn't matter if it's a very big KOL or a doctor that is not considered very high level. We'll talk about the position of KOLs shortly. But the doctor is signing on documents that allows the importation of a pre-PMDA approved technology to Japan. And this is, maybe some of you understand or know this as IRB. It's the technology is used for research purposes, but actually it's used for clinical use, for clinical purposes as well. What does it give the manufacturers when we are foreign manufacturers? Of course, it allows the manufacturer to accumulate Japanese data prior to having PMDA approval. This is part of the requirements that will follow. It allows you as a manufacturer to get the endorsement of key opinion leaders. This is very, very critical, having publications on Japanese data, but I can tell you from my experience, and I think Gilad shares with me the same experience. Actually, when a doctor, a key opinion leader, is asking a local distributor to handle your product, the distributor will follow. The key opinion leaders in Japan have so much power that they can actually, I will say convince, but you understand it in Hebrew, how does it mean? The idea is that these key opinion leaders can actually open your market and bring the distributors or your business partners. Additionally, we know that most Israeli companies are working on a very tight budget and cannot invest in heavy-duty activities overseas. But actually, you are selling the technology, you're selling the devices. It's an actual sell to the hospital. So you are, of course, expected to support the clinical research, but on the other hand, the different hand is getting revenues for sales. I will show you a case studies, and I think it will help you understand. But at the end of the day, while you are working with the doctors, and while you are gaining local data, you also understand how to work in Japan. This creates draw the attention of the players, investors, or strategic partners that can later on work with your product or distribute your product in Japan. Tachlis. So how do we do that? I want to show you two phases. One is the quick market entry, and later on we'll talk about a scale up. The doctor's private import does not allow you to really sell nationwide, very big, very large quantity. It's limited. It's limited, and it's also something that you need to manage. But how do you do that? This is a step-by-step element. So first of all, you need to make a connection to the key opinion leader. You need to find these key opinion leaders. You can either find them directly through publication, through a search of their names in committees or whatever, or you can use a consulting firm to help you do that. That's the first step. After you have met or created contact with this key opinion leader, you need to convince them. So I guess that the first step will be an online meeting. You need to understand that if you suggest to fly immediately to Japan to do an introduction meeting, you will get probably a very big no, because Japanese see it as responsibility. You need to look at it from the Japanese point of view. They don't want to make you do all this effort and all these expenses if their answer will be no. So I warmly suggest you don't jump on a plane and fly to Japan immediately. But the idea is to convince them on an online meeting, send information, answer their questions, and of course, the second step will be to fly in with machines, with demo devices, etc. Then the third step would be to activate and manage the research. So you need to sign an agreement with the hospital, an agreement, a research agreement. You need to allocate budget to that. You need people to fly. You need lawyers' time, maybe consultant times. You need to support the doctors in a way, maybe some expenses, and actually manage the research to the extent that it will be published. Maybe it could be a small publication, it could be a white paper, but it doesn't matter. We need to collect the data, and the doctor is responsible to publish the information. And the fourth part is, after you did all that, you want to sell. So in order to sell a non-PMDA approval device or technology to Japan, you need either to have an agent, what we call the DEMA. It's a registered regulatory agent that has a license to import devices, but also to sell it to the hospital. Some companies are trying to sell direct to the hospital. It's possible, but I think it's only when you have a lot of experience already and you already activated some agents before, because you need to look at it from the hospital side and the doctor side. They don't know how to handle things overseas, especially when you are foreigners. So it's better to have a mediator. By the way, Japanese feel very, very comfortable working with mediators. This mediator is a regulatory agent, can import your product, can do the training, can do the installation, can do the incoming inspection, can answer calls, service calls, or whatever calls, and can actually be your point of contact in mitigating this relationship. So that's,
I have a question that I'm sure a lot of people on the call have similar thoughts. Two questions. First, you describe here quite an expensive process. Looks like, we need to get there, we need to do the market analysis, we need to pay for research, we need lawyers, we need to find an agent. Bottom line, from dollars perspective, or shekels, or yens, doesn't matter. How much we need to invest? So what's the ballpark? So we know that there is actually a return on the revenue side. What's the ballpark? What do you think? What's your experience?
That's a great question. Well, it really varies, but I think that until you got into the third step, you don't need to invest much. If you do this directly, you do it by your own team, your own people, so that's your employees' time or your own time. If you do it with a consulting firm, could be a few $1,000s. Actually, this consulting firm, and I guess that consulting firms don't have relations with key opinion leaders in all the medical fields, but actually, for example, if I take our case, when we know 10 key opinion leaders, I guess that they can lead us to different departments in their own hospitals, as we are doing today. So I don't think that that's a major expense. Again, the meetings with the doctors are, when you do an online meeting, is you don't need to pay that doctor, because that's the doctor is interested in your technology. You need to convince the doctor, so that really won't take time. If you need to fly, my recommendation is that before you fly in, the agreement, the expectations, the publication, all the expectations should be preset with the doctor in advance. I think that from our case in Itamar, we did a crazy research. We changed the guidelines in Japan, and all the overall expenditure was like $80,000, $80,000. But that was a crazy research with a lot of advisors, etc. I think a company should put in $20,000 to $30,000. That payment is not going to be paid immediately. It's going to be paid along the milestone. So if you look annually, I think it's not something very significant. Of course, if I move to step 3 and 4, managing, you need someone that can speak to the doctor and can actually manage the project. But again, it doesn't cost money. Just you need to know how to do that. And Japanese, the agreement is very simple. It's not an American style agreement. Could be 2 pages. What I'm doing, what you're doing, what's the expectation, how much does it cost, and when do we pay? So I don't think that we need to invest in legal fee in such a great magnitude. And the activating a regulatory agent is actually not so expensive. And as companies, we need to find a nice way of compensating them. Could be some percentage from the deal, it could be some advisory, but it's not a hassle for them. And their expectation, by the way, and this could be a leveraging point for the manufacturer in Israel, they will do the work in a modest way. And they are expecting that once you are ready to file for PMDA approval, you will do it through them. That would be their main compensation. So I don't think that this process should be very expensive.
Thank you, Ryan. Maybe just clarifying question, because the name Doctor Private Import System, right, suggests that it's the doctors importing the device. So when I'm approaching the doctor, is it something they're familiar with, or it's something we guide them to do? What's their role? And what should I manage expectation with them? Because it's, in the end of the day, it's not that we are importing as a company. It's the doctor actually is the importer. So tell us how that works and what the role and who is managing the role with the doctor.
Thanks for this amazing question. So actually, the doctor is signing the document as the representative of the hospital. It's not that the doctor is paying. It depends on the size of the hospitals, but it could be a budget of the hospital. Usually it's the budget of the department, but it's the doctor is the face that is signing the document. So let's look at it in the other way. The authorities in Japan will not allow an import to Japan without an address. So once the doctor puts his name and the title, etc., that's good enough for the authorities. And then, of course, the hospital is paying. So it's a lot of paperwork, but the agents know how to do it. So, it should be straightforward. And by the way, key opinion leaders are doing that often. A lot of companies are contacting them, so they know the drill.
Thank you.
All right. All right. So once you have accomplished a few installations, and by the way, this could be millions of dollars. If you would like to scale up the activity, you should move from the doctor's private import system to a normal distribution. In this case, you need to file for PMDA approval. You can do that through agents, as we mentioned. You can, if you tied up with the distributor, you can ask the distributor to do that. Most Japanese distributors would like to conduct the PMDA approval, first of all, because they trust themselves, and when a foreign company is doing that, we are expecting a lot of troubles, especially to be lost in translation with the Japanese PMDA. So That's one thing they will do. They will pay and they will do the PMDA registration on them in return to exclusivity. So you need to think strategically if you would like to have an exclusive distributor in Japan or a non-exclusive distributor in Japan. That's a question that you need to ask yourself. There are advantages here and here, so I don't want to get too much into that. Or you can do it directly. We know that some companies are trying to work directly with the PMDA. I wouldn't recommend that. It's a big, big hassle. And you don't save too much while doing it directly. You will need to fly in for everything. So that's a big hassle. And the second step is to appoint a distributor. So if you decided, for example, to register the product with a local agent, you still need a distributor, exclusive, non-exclusive, which one to choose, that's another story. And you need to think how you would like to manage the market. Would you like to register a local entity like a KK, which is a Kabushki Gaisha? It's a LTD, what we know as LTD. You would like to manage it from overseas, so your country manager is managing the distributor. You would like to use freelancers on the ground, so to have boots on the ground. So it's really up to you. But at the end of the day, I put the picture of Tokyo. This is Shinjuku, just to show you how complex Japan look like. That's a main street. This is how the Japanese market looks like when you want to start doing business and you don't understand how to enter. So that's just to illustrate that. Let me walk you through a case study that I can talk about. IceCure Medical is a public company, so we can speak about that. And some of this information is known to many of you. And if you don't know, I'll walk you through that. So first of all, IceCure has a very interesting surgical oncology cryoablation technology. The company started working in Japan 3 or 4 years ago through their own connections. They tied up with a few, now we have more, but two leading key opinion leaders actually started to install the machines in their hospital and started to work. Nowadays, in 4 centers, the company already generated $500,000 and growing. The expectation is, of course, to grow. And by working with these key opinion leaders and by collecting the data and by showing that the technology is unique and effective, actually they created they caught the attention of Terumo Corporation, and Terumo decided to tie in and sign a distribution agreement with IceCure to handle Japan and Asia. The preparations for the PMDA took almost a year and a half, and the registration is planned to start in January 2025. But at the end of the day, because of the Japanese experience, they almost started to distribute IceCure in the Philippines and later on in Thailand. And the expectation is to move forward into the other Asian markets, while the PMDA registration will be conducted in Japan. Now, it's not a secret that once Terumo or any other giants like that. Terumo, by the way, is valued at $25 billion, selling all over the world, has $6 billion revenue per year. The idea of full M&A or global distribution is the next step of being successful in Japan. So I think that IceCure can give us a very big motivation for trying this, starting in the private import system, but ending up hopefully in a full M&A. So to summarize, I think that it's very important when you are starting your business in Japan to do your homework. Not to jump on the first opportunity you have, because you need to know also how to avoid some traps. And not any Japanese company that you meet and is interested in your product would be your most suitable partner. You need to be very careful. Once you make a move in Japan, and we have great success stories in Itamar that I can talk about, but also a lot of failures. Once you choose the wrong distributor, it's very, very difficult to get out of that vicious cycle. So please do your homework, understand your market space, and also understand how to work with Japanese. Japanese has a very unique culture. You need to do it their way. They won't bend to our way. I think that the strategic decisions you also need to understand or to check is, what is the positioning of your product? What is the price range? You need to be very careful with the pricing, because you need to understand the reimbursement system in Japan. Sometimes the reimbursement in Japan is lower than the American one, and naturally we are planning for the American model, so it's not copy paste to Japan. And also know where do you stand on the regulatory pathway. And Japan is not just a market. I think that if you want to enter Japan and you want to do business in Japan, you need to be focused. You need to have the budget. You need to know your market. You need to have the network, and of course you need to invest your energy there. From my experience, this is a very rewarding effort. That's it. So I will be very happy to answer any questions that you have, if you do.
Thank you, Ira. Someone have a question? Okay.
You're not Japanese. Japanese don't ask questions on seminars, but please do.
I'll ask one question.
Ran, thank you. You really saved the bear. Yeah, go ahead.
So you talked before about, you described the distribution network, etc., and you talk about exclusivity or non-exclusivity in distributor in the distribution network.
Yeah.
I mean, what is your perspective of that? Should someone get few distributors, exclusive relationship? What is your perspective on that?
I'll try to do it to give a very general answer. Of course, it's a case by case. If you have a very sophisticated technology, it's not a commodity. It's not I don't want to insult anyone, but it's not a class 1 or a OTC or something like. You have a technology with a product, patents, etc., and you would like to build a market, I would recommend exclusivity. For two reasons. First of all, your brand will be very much connected to your business partner's brand. And so it gives a lot of power to both of you. For your exclusive distributor, it gives the power of handling some very sophisticated technology exclusively. And for you, you have one point of contact that you can manage. If you are working on a non-exclusive basis, there is also risk of cannibalization, of pricing, and other commercial elements. So it's very difficult to split Japan into parts, into regions. So I definitely recommend exclusivity.
Thank you.
Sure.
If I can, I have a question.
Yeah, go ahead.
Yeah, hi. I'm Adib from Imaging, and you've indicated that step 3 of the whole process is about engaging in a research in Japan. Let them experience with your product and pretty much gain their own evidence with your utility in their medical setting. You said it's only a few $1,000s, and I don't know, just I know that anywhere that you want to conduct a research, it's more closer to tens of thousands, even hundreds of thousands of dollars. So pretty much appreciate if you elaborate on that.
Okay,
Thanks.
so I'll elaborate on that, and thank you for asking this question. So it depends on what kind of research you would like to do. Actually, what is the nature of the research? There is a first evaluation that the doctor is doing with your product. Okay, of course, we need to pay the hospital, but I don't think that this is something very, very substantial. When you want to meet the Japanese requirements of the PMDA approval, assuming that the PMDA will say, okay, you have technology A, for that we need at least 36 patients, or you have technology B, we need 120 patients. This is the multiplier. Okay, so I mentioned Itamar Medical, we had a crazy research, okay, on 116 patients. That was over $80,000, okay? But it close to 100,000. But it really depends on what you need. The first step will be the evaluation. You need to engage the key opinion leaders. Then you can actually, depends also on everything should work in parallel. So assuming that you're also already having some discussion with a potential business partner, they can join in. Sometimes it falls only on you. Sometimes you can join in with your local partners, so you are sharing the costs. I hope it helps.
I see. So if you run a initial evaluation, low cost, but it increases with the amount of patients, and definitely if you want to have some multi-site or any prospective study or
multi-site
required, then it's going to be much more.
We explained today a very nice shortcut to a market entry, but I don't think that there is an absolute shortcut to overcome the PMDA requirements. So at the end of the day, the functionality of the private import system is to create three things. One is engagement of a key opinion leader. The second thing is to collect local data. And the third thing is to create initial revenues. You won't be rich from selling the few systems, but you are creating all the infrastructure for registering the product under, let's say, the King's Road of a PMDA. If you try to do it before you did that, you start from scratch, and this is very, very difficult. It will cost much, much more to start from zero without having some work in Japan before.
Ira,
yes.
I wanted to ask you something. In order to go through the private importation process, just to make sure, you must have a FDA or CE?
No, you need to have a CE, but you don't need FDA.
Okay, C is enough.
C is enough.
But
that's why we said that you can go to Japan before you have FDA approval.
Okay, but you must have one of them.
Yes, you're right. So in order to, the PMDA will look at either a FDA or a CE, but as we know, I guess that you are sitting in the same chair, you know that as well. We as Israelis, we need a CE, but we are not filing thanks to Amal, right? We are based our reference on CE. So I guess that for Israeli companies, the CE is the first.
These days with MDR, it depends.
Yeah, well, you're right. So things are changed. But yeah, to make a long story short, you need either FDA or CE.
Okay.
By the way, you can use your old CE. You don't need the MDR.
My own
if you already obtained the CE, you can file use the file of the old CE without
the old CE.
The old, yeah.
Okay.
The original CE.
Yeah,
that's mine.
Would it also mean that CSA is enough?
Sorry, I didn't hear.
Would it also mean that CSA is enough, the Canadian?
I'm not sure. I don't want to say that it's something that I'm not sure about, but I think that the Japanese are looking at either CE or FDA. I think that the Canadian is unless the Canadian is equivalent to the FDA, but I'm not sure about that. I don't want to give you a
Canadian, you need a CE or an FDA, as far as I know. So
okay. So the chicken and the egg.
And what if you have a diagnostic product and it's, for instance, a CLIA certified lab in the US?
It's clear what?
CLIA certified lab in the US, and it's a diagnostic product.
Again, I think that the minimal requirements is having either an FDA or a CE. But that's a general thumb rule. Every specific. I will give you one example so you understand, and I won't name the names of the company. We had a case that the company is coming for a diabetic device that actually should be all in one, okay? Not a glucometer and not without giving too much details. When we did the analysis of the regulatory pathway, we found out that the strip, the lacquerous paper, is considered to be a pharmaceutical level device. So when you combine a medical device, which is very simple, with this pharmaceutical device, you turn it into a pharmaceutical device. So a simple product, which is a class 2 in the United States, is totally blocked in Japan unless you're going through a pharmaceutical route, which I definitely don't recommend for a small company. So we talked here about a general route, but I warmly recommend that before you are doing your starting to pave your way into the Japanese market, you need to do a basic analysis of where your technology sits, where on the regulatory spectrum it's positioned. What does it mean? You need to do some homework. It's not just going on a plane and trying to open the market. There are a lot of elements that you need to check. It's not a big deal, but you need to do a little bit of homework before you are running into Japan. Japanese will not give you a second chance. You need to remember that. You have a first trial to do a very, very good first impression.
Okay.
Don't be discouraged. We see a lot of success in Japan, so it's a great market. Yeah, sorry.
No, I wanted to thank you, Ira, for your time and everyone for joining to the great webinar. Of course, as I said, the webinar is recorded, so you can find it also on our website later on. Thank you, Ira.
Thank you all. Thank you for joining, and
Bye.
thank you for so many questions.
Thank you.
All the
Thanks.
best. Bye-bye. Thank you.